My name's Sandra Corry. I'm Director of Quality and Nursing for Somerset CCG, and I'm going to spend the next half hour just taking you through where we are as a Somerset system with regard to our flu plans and progression on the delivery of that for 2020. So why is flu important this year? It's particularly important, as we know, it can actually kill over 11,000 people every year. And on average, some years it can be sadly much more, and it hospitalises many more people each year. And as we know, this year is anything but an average year. When you factor in the COVID virus and the fact that we have flu on top of that, the pressure that will place on the health and social care system is going to be incredibly challenging. And the flu virus, as we know, spreads from person to person, even amongst those that may not be showing any symptoms. And it can cause severe complications, particularly for those people that are in high risk groups. And I'll talk a little bit about that later. So keeping your guard up against the flu virus is going to be particularly important this year, as is making sure that we get as many people to access the flu vaccination as possible. And whilst the threat may be invisible, protection against it is very clear. So getting that flu jab is really important. So I want to spend a few moments just talking about our Somerset demographics, which you can see on the slide in front of you. And I think it's really important to note that the population in Somerset rises by about 4,000 people every year and has done since the last 5 years. 48% of those people in our Somerset population live in a rural area, and 7.5 of those people in our population are children. And about 1 in 4 of the residents in the county are over the age of 65, and that's really important in terms of when we think about who's in our high risk factor group for flu. And in West Somerset, the highest percentage of people are 65 plus, which is a really high proportion of our population. And over the past few years, there's been 5,224 live births in Somerset. So our population is constantly growing. So who is this important for? As I've mentioned before, this affects health and care, and particularly our workforce need to protect themselves this year in those settings. It will affect our 65 and over risk groups, and later in 2020 we'll see that opportunity for people to access the flu vaccination by the NHS will be increased to people 50 to 65 years old. And the other risk groups that I'll talk about in a minute are also those people that are currently on our COVID shielding list. So those key risk groups, if we drill down into it a little bit further, are people that are 65 and over, pregnant women, children and adults with an underlying health condition, such as a long-term heart or respiratory condition, and also children and adults with a weakened immune system, for example, people with autoimmune liver conditions. So more people this year, as I mentioned earlier, will receive the vaccine through the NHS this year. So people who are actually living with somebody who's at high risk from coronavirus and are already on the NHS shielded patient list will be eligible for the flu vaccination. Children aged 2 and 3 on the 31st of August will also be included this year in the opportunity to have that vaccination. And we really need to encourage protection for that particular cohort of young people. And also children in primary school, and also those children in year 7, which are in secondary school young people. And as I said earlier, particularly important this year for our health and social care workers to actually access that flu vaccination as soon as they possibly can. And then later on this year, we'll hear more information about the people that I mentioned earlier, which will be included this year in the NHS list for eligibility for the flu jab, and that's those 50 to 64-year-olds. So if you are 50 to 64 and in an at-risk group, in any of those groups that I mentioned earlier that maybe have an autoimmune condition or have a long-term condition, it's really important that you try and get your flu jab sooner rather than later. And I'd encourage anybody to actually not delay in actually accessing that flu vaccination rather than waiting till later in the year when we hear about the formal route. And there are lots of routes that you can actually access, like your pharmacy, where you can actually go in and actually get your jab without waiting for your GP to contact you. So our Somerset flu response this year has been particularly strong, and the way that we've looked at it is actually by coming together as a whole health and care system, and actually looking at three key themes where we wanted to focus on ensuring that our population has good access to the flu jab. So we focused on primary and community care. We've looked at how our trusts are making sure that they can support that their workforce to actually get their vaccination, and also our CCG, Clinical Commissioning Group, how our staff can actually access a flu jab. Looking at it from a wider perspective, we've understood that making sure that that wider system flu uptake needs good partnership working. So we've established a Somerset flu group, which includes public health colleagues, the local medical council, the local pharmacy council, both of our NHS trusts, which is our acute trusts, our mental health and community services, our CCG colleagues, Leeds, and our local authority council and Public Health England are all part of planning and actually making sure that we can reach as many people as we possibly can this year. So planning the up and coming flu season with COVID-19 constraints in mind has been particularly important. Thinking about that bigger platform and complexity has been very, very key for future planning. And working in partnership to look at a joint approach to maximising flu uptake has been essential. The flu group itself has actually broken down into three smaller task and finish groups, focusing on three key areas where we know there are particular issues that we have to iron out and actually ensure that scope and reach for everybody is actually enabled as best possible. So looking at the financial challenges, looking at primary and community care challenges particularly, and looking at communications and engagement, making sure that those are as effective as possible is absolutely fundamental. Taking that down into a little bit more detail, that means having really strong system leadership, which is why I'm here today talking to you, but also leading that system engagement across all of our multi-agency providers. Extended cohort and uptake of ambitions is absolutely essential this year. So setting out our plans that look at specific activities in the local system with our partners will help deliver to support seasonal flu vaccinations for the expanded and extended cohort of people I talked about earlier, in terms of ensuring that people have good availability and access to those services. And that means making sure that we've got the right vaccine supply in the right place, that we have the workforce available to deliver it and to sustain our system, making sure that we look at different delivery models and estates that may challenge the normal delivery of the flu vaccine, with COVID challenges also dominating at the moment, is really important. And looking at data flow. Considering inequalities has absolutely been essential, so making sure that we can reach out to those hard to reach groups in a different way. So looking at people in their own home, in care homes and secure settings is equally as important. And also understanding how we can reach out to our mobile communities, such as people that are homeless and nomadic communities as well. Looking at our frontline workers, I've talked a lot about how we reach our health and social care workforce. That is going to be really important this year, because we've got to achieve the 100% uptake as far as we possibly can. And that is a key driver for us across the country. Looking at our community settings, thinking about how our plans in our system will reflect and maximise the offer to uptake flu is essential. That's making sure that we have different different outreach models to people that are stuck at home, that are shielding, people that are housebound, and people in the care home or a nursing home. Our communications and engagement plan will be really important this year, and it will complement anything that comes out nationally and help to actually ensure that those hard to reach groups actually have key messages that mean as much as possible to them, to enable those groups to take up the opportunity for a flu vaccination. And innovation, thinking differently about how we roll out our flu programme is really, really key. So we're looking at things like large-scale rollout options, commissioning alternative models to cope with demand for vaccinations, with the potential for large-scale options such as a drive-through. So having our GP practices with the ability to actually have a drive-through opportunity where you could drive in as a patient, get your vaccination and drive back out again. A lot of our GP practices have quite old buildings or buildings that don't enable really effective social distancing. So that's one option that people are considering. Having a mobile facility that can actually go around local towns and villages to support capacity where we've got those GP surgeries or our pharmacies that actually can't cope with the increased numbers in the way that they would like to is going to be absolutely key as well. And alignment and combination with our COVID testing hubs is another option that we're exploring at the moment. I'll talk a little bit more about that in a minute. Looking at things like the utilisation of our town halls and unused sports facilities at the moment, such as cricket grounds and rugby clubs, is another option that we're exploring heavily at this stage. And using, as I've said earlier, village halls and also schools, colleges and various workplaces will be fundamental in actually looking at building capacity for the public and our workforce to actually access their jab in a different way this year. So what does that look like? Well, what we're ultimately trying to do is provide patient choice, enabling our population to actually choose and actually access that flu vaccination in lots of different ways is going to be really important. So I've talked about primary care. A lot of places have really good facilities. Some practices are contained within perhaps more historical buildings that don't enable that large scale or safe distancing. So having a drive-through or having an alternative venue will be really important, and that equally applies for our pharmacies. Our hospitals are making sure that they consider where they have outpatient clinics, where it's appropriate and safe to do so, supporting you if you go for an outpatient clinic, say for, I don't know, a liver clinic, you may be offered your flu vaccination at the same time, and that will be an option that you have. Not everywhere will do that, but where it's appropriate, that will be a consideration. And then the other option on here is one that we're exploring at the moment with our regional NHS England colleagues, is around having a one-stop shop. So there may be an opportunity to provide a flu vaccination or COVID vaccination when it arrives, along with COVID testing and antibody testing for COVID as well, all in one venue, where we can actually ensure that the patient pathway and the footfall is socially distanced and works really safely under infection prevention control guidance. You'll hear more about that in the coming months. And then last but not least is our governance and thinking about how we do that safely to ensure that we have effective patient safety, as I've mentioned, around infection prevention control, and working at all times to really sound clinical standards. So the takeaway messages really that I'd like people to consider and think about is that this year is anything but a usual year, and we all want to protect ourselves and those that are close to us. So making sure that you can actually support and get the flu jab as quickly as possible is really, really important. As I said at the beginning, flu can be deadly, and it is very easily spread. You can have no symptoms at all, but you can still spread it to your friends and family and patients. We have all have access to the best protection available, which is that flu jab. That flu vaccination is absolutely key this year. It will help us manage our services when we know that we're going to have further increased activity around COVID. So it's really important to try and ensure that our workforce and our population take up that opportunity for a flu vac. And finally, we have really solid and robust infection control measures in place across all of those settings that I've talked about, in GP practices, in pharmacies, wherever we roll out the flu vaccination service. So please ensure that your patients, or if you're a member of the population, member of the public, or a member of staff, that you access your flu jab this year. And finally, a big thank you to everybody in Somerset. Without you, we couldn't keep the services running this year. We really need your support.